my name is Vanessa Hushard, and I will be completing the nursing assessment for Module 6. This is my model, Chris. As my model, do you give verbal permission to participate as a model in the assessment assignment and be recorded for school purposes for Aspen University Class N495?
Yes.
This assignment is intended to show my skills with the assessment actions only and is not to be used as direction for your health status or follow-up with any irregular findings. Do you understand this?
Yes.
Okay. So, I would come into the room, I would wash my hands, I would come over and I would introduce myself. Hello, my name is Vanessa. I am your nurse today.
Hi.
Can you please tell me your name and birth date?
My name is Chris Hoosier, and my birthday is January 26, 1987.
Can I look at your wristband? Thank you. I'm just going to verify the information that you gave me is correct and it matches and we have the right patient. So, first we're going to go ahead and get your vitals. So ideally, it would be preferable to go ahead and get a manual blood pressure, but in this circumstance, I don't have one. Temperature is 99.1. And if there are any irregularities with the vital signs such as blood pressure or pulse rate, it would be appropriate to go ahead and obtain manual readings, like a manual radial pulse, or getting a cuff and doing actual manual pressure. At this time, checking his respirations. Seven, 16. Blood pressure is 129/69. And pulse rate is 84. Okay. Would you say you're having any pain today?
No.
Alright, so at this time, I would go ahead and start at the top of my patient and checking him over. I would want to go ahead and check facial symmetry to determine if there's any abnormalities such as a drooping lip, drooping eyebrow. I'd go ahead and check the ears, see if there's any sort of abnormalities in the ears, if they're having any difficulty hearing. Can you hear that? Any issues with drainage or anything from those? Have you had any sore throat or cough or anything of that nature?
No.
Can you please go ahead and stick, oh wait, hold on. Let me get my pen light. Okay, go ahead and open your mouth. Okay, stick out your, oh, thank you. I'm going to check your eyes, shine a bright light. Pupils are equal and reactive. No redness in the eyes, no drainage. So can you go ahead and clench your jaw? Okay. Can you smile? Frown? Can you raise your eyebrows? Can you close your eyes tightly? Open them wide? Okay. So obviously we're just assessing the cranial nerves to determine if there's any weakness or abnormality. Forgive me. I would also at this time go ahead and take the opportunity to check around and see if there's any lumps, masses, any sort of swelling in the throat, if there's any sort of deviation, any jugular vein distension being noted that I might need to know about. So, moving down, go ahead and start a respiratory assessment. Okay, take a deep breath. Go ahead and breathe normally. So at this time, while he's breathing normally, I would want to go ahead and take a listen to his heart, listen to see if there's any murmur or anything of that nature. At this time, lungs are clear and there's no notable murmur. I'm going to take a listen to your belly. Bowel sounds are active. Okay, any pain?
Nope.
Belly's soft, non-distended. All right, I'm going to take a listen to the posterior end of your back. Okay, big deep breath. Again. Okay. Lungs again are clear. I'm going to pull up your shirt and take a look and see if there's anything going on with your skin. Okay. Back is clear. There doesn't appear to be any abnormal skin issues. So at this point, we can move down even further. Again, checking the arms. No abnormal skin issues. You can go ahead and check inside of the armpits and determine if there are any swollen lymph nodes or anything of that nature, or even check for skin breakdown. Commonly in older individuals, you can have skin breakdown in the axillary area and under any sort of folds or anything like that. So as you work your way through, it is appropriate to go ahead and check your skin on the way down. Do you have any skin issues that you're concerned about that maybe I cannot see right now?
No.
So going through, as we can all see, skin's normal. He's not diaphoretic. He doesn't have any sort of redness or anything that we need to further address. Let's see. Okay, so go ahead, follow my finger, up, down, over. So pupils are appropriately responding and following the gaze appropriately. So we check there. Moving down, should this patient be an in-hospital, say intubated type patient, we would go ahead and check the perineal area, see if there's any sort of swelling, redness, any sort of skin changes that need to be addressed, and take it from there. Again, checking all skin. Moving down to the legs. This is a good time to go ahead and assess the legs, see if there's any sort of fluid retention or anything of that nature, discoloration, wounds. I can also check and see how his neurological status is still continuing. So can you go ahead and push down on my hands? Okay, pull back. Good. Any pain when I push up with your feet? Any pain here? No? Okay. I could check his pulses, make sure we've got good perfusion down. I could also check capillary refill of the toes. Socks are left on at this time. And moving up, and you're able to feel this.
Mm-hmm.
Feel that.
Mm-hmm.
Feel that.
Mm-hmm.
Feel that.
Mm-hmm.
That.
Mm-hmm.
That.
Mm-hmm.
Okay. That.
Mm-hmm.
Okay. Can you squeeze my fingers? Okay. So negative nerve response. Nothing abnormal that needs to be followed through with anymore. So following through, I can see that his respiratory rate is normal, no shortness of breath. You haven't had any cough or anything that we need to know about. Okay. I already checked the rest of the chest. Check the carotids, abdomen, extremities, neurological. Okay. So I'm going to go ahead and have you stand up. All right. Can you lean forward? Okay. Go ahead and come back up slowly. Okay, good job. And as you can see, he's standing straight. He's not, are you having any dizziness or lightheadedness?
No.
He doesn't have any swaying. You just swayed. because I said so. All right, you can go ahead and have a seat. Okay, and then no major issues from going from sitting to standing or standing to sitting. And I do believe that that's it. So it's the completion of our assessment.